Fatigue is an unusual and often significant complaint in a child. The natural forces of growth and development always encourage a child to be active and striving for new milestones. An observed pattern of fatigue requires evaluation. Symptoms. Children generally develop a pattern of activity that is well recognized by their parents. Although children differ in temperament and amount of physical activity, each child's pattern remains more or less constant. An observed pattern of fatigue at almost any age requires an evaluation. Activity level. Note whether the child tries to engage in normal activities and is unable versus the loss of desire. Does the child show signs of increased respiratory effort as part of the fatigue? Are there psychological factors or issues of family disruption, change in appetite and other systemic signs, e.g. fever, night sweats, and so on, which might point to chronic infection or malignancy? Changes in personality or in cognitive function might point to a psychological problem or substance abuse. Who are the child's friends? Review the grades on the most recent and past report cards from school. Sleep habits. Review with the family the child's sleep habits and their pattern of activity. Does the child have any downtime, or is every hour scheduled with school, lesson, and group activities? Signs. The patient needs a complete physical examination. Examine the child for pallor and any abnormality in the lymph nodes, liver, or spleen. Does the child appear anemic or have a cardiac murmur or tachycardia? Neurologic signs. Evaluate the child's neurologic examination with attention to cognition, coordination, and muscle strength. Exercise the child in the office to differentiate generalized fatigue from muscle weakness. Psychological function. Look for evidence of depression, anxiety, or signs of post-traumatic stress disorder. Investigations. Investigations will depend on the findings of the history and physical examination. A reasonable initial evaluation should include a complete blood count, urinalysis, mononucleosis testing, and liver enzymes, muscle enzymes, and other neuromuscular studies. If there are specific concerns about muscle strength, chest radiography, and pulmonary function studies, e.g. tidal volume FEV1, if there appears to be a respiratory or cardiac cause. Psychological assessment will need to be explored in depth, and consultation with a mental health professional may be necessary. It is important to remember that depression may be both cause and effect of fatigue. A child with hepatitis or mononucleosis or a brain tumor may also be depressed. Complications. Complications will depend on the underlying cause of the fatigue. Differential diagnosis. Infectious/post-infectious. Viral myositis, mononucleosis, hepatitis, tuberculosis, Lyme disease, post-viral or mononucleosis-like illness. Endocrine/metabolic. Hypothyroid/hyperthyroid. Hypoadrenal. Hypokalemia. Tumor. Leukemia, lymphoma, other tumors. Allergic. Reactive airway disease, chronic rhinitis. Antihistamine-related. Congenital. Neuromuscular disease, muscular dystrophy. Other. Sleep disturbance from upper airway. Obstruction or other causes, psychogenic. Drug abuse, anemia, congenital. Heart disease, including dysrhythmia. Chronic fatigue syndrome. Etiology. There is no single cause for this complaint. It may relate to muscle weakness, inadequate cardiorespiratory function, including anemia, central nervous system disorders, abnormalities of energy production, lack of adequate sleep, or psychological mechanisms that decrease motivation, such as depression or substance abuse. Epidemiology. The epidemiology of fatigue is unknown. In a recent survey of sleep problems in school-aged children, 17% had fatigue complaints. Adolescents will need increased amounts of sleep and may select unhealthy sleep habits if allowed. As the age of the child with fatigue increases, the likelihood of an organic pathology decreases. However, an organic pathology should be ruled out in all cases. Other information. The final entity in the differential diagnosis listing is a diagnosis of exclusion. Occurs in the adolescent and young adult population and is characterized by fatigue and neurological findings such as loss of attention span, confusion, loss of cognitive function, and memory impairment. This may represent some undescribed form of encephalitis. Treatment. General treatment. The treatment of fatigue depends on the underlying cause. Treatment may need to be multidisciplinary and include the physician, visiting nurse, mental health specialist, and physical therapist. Initial therapy consists of a comprehensive workup to establish a diagnosis and treatment plan. While awaiting a diagnosis, the child should be allowed to set their own level of daytime activity but should have strict guidelines for bedtime. A well-balanced diet should be offered and supplemented with a standard multivitamin. For school-aged children, consultatio